Center for this invitation to talk in this workshop. If we move, so I will be talking about some environmental aspects and also criteria that we're taking in consideration at GARDP. As most of you all know, we are facing a global health crisis and antibiotic resistance. And if we can move to the next slide, please. Bacteria are clever, and every day they are evolving and building their resistance against an arsenal of antibiotics. Over the past decade, we have seen an explosion in the number of infections from resistant bacteria. And instead of being killed off, these so-called superbugs are learning to outsmart and resist the working mechanisms of some of our longest standing and most trusted antibiotics. Therefore, we need constant innovation to keep up against this natural evolution. And if we move to the next slide, please. As you all know, superbugs know no borders. The last example we had was COVID-19, but even before that, the spread of the NDM1 in 2015 outreached more than 70 countries around the world. Next slide, please. And with this, GARDP is making progress on antibiotic resistance and has been recognized by the United Nations, which has been recognized by the United Nations General Assembly as critical in order to achieve the Sustainable Development Goals, the SDGs. I think these SDGs are well known by all of you, so I will not take a long time to go through them all. Next slide, please. At GARDP, we are conscious that to achieve meaningful change, we need not only sufficient political will, resources, but also a holistic One Health approach that will embrace efforts to redress the inappropriate use of the antimicrobials in humans, animals, and of course the environment, which are all inextricably linked. Antibiotic resistance is in fact a prime example of One Health's importance as an approach. And it is one of the 3 areas that can potentially impact the health of others. Sorry, was there a question? I guess not.
No, it's just a leakage of the audio. Apologies, Elizabeth.
Okay, no problem. So now more than ever, governments and key actors around the globe have the opportunity to counter the spread of AMR and to take specific actions to address the global issue of drug-resistant infections. Next slide, please. And with that in mind, GARDP is accelerating the access to antibiotics for appropriate use around the world. In this moment, GARDP has a pipeline of medications in different phases of development to address the World Health Organization priority pathogen list. And our goal is to develop a package of treatments that can complement each other, or in some cases can be used in combination with each other or with already existing medicines to address serious bacterial infections, including sepsis, pneumonia, and bloodstream infections. With partner collaboration around the world and support, GARDP can ensure that antibiotics will be affordable, available for use across populations, including children and neonates, and that they will be used appropriately to slow or minimize resistance. Next slide, please. One of our most advanced projects is the cefiderocol access project. And this is a collaboration. We have signed the first license agreement for an antibiotic to treat serious bacterial infections between a pharmaceutical company, Shionogi, and a nonprofit organization driven by public health priorities, GARDP. And we have also signed a collaboration agreement with Shionogi and the Clinton Health Access Initiative to help expand access to cefiderocol, especially in the countries that have the highest burden and unmet needs. Next slide, please. So this license covers 135 countries in GARDP's territory, but for our wave one implementation and introduction, we have shortlisted 14 countries, which have the highest unmet needs, but that we also consider that they have an enabling environment to ensure appropriate use and stewardship. And as you can see, most of those countries in wave one are in the south, including Mexico, Brazil, India, South Africa, Pakistan, etc. Next slide, please. And with this, I'm going to speak to you about the environmental aspects and criteria for suppliers. So right now, GARDP is pre-selecting the first generics manufacturer for cefiderocol. And of course, the environmental aspects and criteria are very important if we want to preserve the power of this antibiotic. So to start this section, and as you can see, there has been several studies that have highlighted the number of pharmaceuticals that are detected in surface water, groundwater, tap water, and even drinking water. Next slide, please. And as you can see, there has been also studies that specifically show the evidence of high concentrations of antibiotics in receiving waters, rivers, lakes, etc., around the globe, but especially in India, there has been several cases. Next slide, please. Having this in mind and knowing that AMR in the environment is a cross-cutting issue, it cannot be tackled only by one player or only in one front. We know that the wastewater from manufacturers, hospitals, business, even the households are sometimes treated at municipal wastewater treatment plants. However, these municipal wastewater treatment plants were not designed to remove small organic pollutants, such as the active pharmaceutical ingredients or pharmaceuticals in general, and they are unable to completely eliminate these pharmaceuticals from the wastewater, and then they end up in the environment. Therefore, pharmaceuticals and even their transformation products have a direct pathway into the environment when the final effluent is discharged into receiving waters. Next slide, please. In terms of what GARDP is doing and has been doing for a while now, so we are working and developing our environmental strategy. We are refining environmental criteria to include in requests for proposals for suppliers, such as the generic manufacturers. We are also developing environmental conditions that will be included in the manufacturers or suppliers' sub-licenses. And we're at the same time, we're looking at what is being done by important initiatives and important initiatives and stakeholders like the WHO Technical Brief on Water, Sanitation and Hygiene, known as WASH. We're also looking at the United Nations Development Program, specifically for the Procurement in Health Sector Initiative. We've been looking and engaging with people from the Joint Nordic Environmental Criteria, which is known by Green Procurement. Also been looking at the Pharmaceutical Supply Chain Initiative and all the criteria and the system that they already have in place. We also been looking and in contact with the AMR Industry Alliance relating to the predicted non-effect concentrations for the environment for the active pharmaceuticals ingredients. And last but not least, we've also been looking and engaging with the Stockholm International Water Institute, SIWI, on their responsible antibiotics manufacturing platform and the framework that they've been developing and how we can collaborate together. Next slide, please. So with this and getting more specific, as I mentioned, we are pre-selecting the first generics manufacturer for cefiderocol, and we are doing the due diligence. We're going to try to do the right thing from the start. And by due diligence, there will be due diligence audits, not, focused on environmental health and safety, etc. There will be also other audits, but for this topic here, I will just stick to the environmental and safety audits. So what does this due diligence audits will look into? They will look into the suppliers and their manufacturing sites or facilities. And one of the things that we think it's important is for a supplier or a manufacturer to have an environmental management system and an occupational health and safety management system. Another thing that we consider important is the standard operating procedures and manufacturing or suppliers fact sheets for consistency with environmental permits, orders, licenses, and any other regulatory requirements, regional, local, depending on where the supplier is located. A very special concern, of course, has to do with the wastewater treatment. And in this case, there are several technologies to treat wastewaters. I will not, keeping time in mind, I will not go very deep into it. Just to mention that the technologies implemented at the suppliers or the manufacturing site are very important. Some sites have what they call zero liquid discharges, and it is important to understand how this is achieved because there has to be considerations about if water is reused or recirculated, if it is incinerated, etc. Another thing that we have in mind and consideration all the time are the sampling points, the key process parameters that are monitored, as well as the thresholds, the targets for not only specific environmental parameters, but also for API and the respective monitoring frequency. We look at least 5 years back to see if there has been any breaches or non-compliances with the environmental permits and that they hold. And also, it is important to see what actions have been carried out to improve the wastewater treatment and to make sure that the active pharmaceutical ingredients are not released into the environment. Next slide, please.
Elizabeth, if you can be wrapping up, please. Sorry.
Yes, sure. I will, I will speed up a little. Thank you. So with this, we just want to ensure that the suppliers have appropriate wastewater treatment and waste management with specific focus on hazardous waste, certified industrial cooling systems. Another important point, I think it's chain of responsibility. Basically, if across the supply chain, they demand that their own suppliers and contractors follow all applicable environmental health and safety laws and regulations, and of course, environment and safety and concrete risks, potential mitigation actions and areas of improvement. And I think my last slide will be next. AMR is an environmental AMR in the environment is a cross-cutting issue, and it requires that multiple stakeholders and partners who have the same shared goal to work together in a One Health approach to counter antimicrobial resistance worldwide. And with this, I end my presentation. Thank you, everyone, and I will welcome any questions.
Thank you, Elizabeth. So we have a very concrete example of organization already trying to do this actively in the innovation system, but then also concerned about the realities of suppliers. So I'd like to just check if there is anyone who'd like to ask any particular question to Elizabeth. You can use the hand function. As we wait for hands, oh, yes, Anthony. Please go ahead.
Well, thanks so much, Elizabeth, for a great presentation on actually how GARP might address this issue. And it's great to see that they're looking into how it might be done. We were hearing yesterday that a key approach really to limiting antibiotic discharge is how the manufacturing process is engineered. And I was wondering if in GARP's discussion with Shionogi, whether or not you have an idea whether or not the product manufacturing process, of course, the FIT recall, from the outset has taken account and the potential discharge from it, because that seems to be the real starting point for a more green, actually, pharmaceutical manufacturing process. And you mentioned a couple of players like the AMR Industry Alliance and the Stockholm International Water Institute. I'm wondering if they have done more outreach to particular low-cost API manufacturers from low and middle income countries, because it seemed like much of their efforts have been more successfully engaging multinational companies and their subsidiaries. And the reason why I ask is that, if not, how will GARP take into account the need to really maintain a sustainable, low-cost API manufacturing pipeline, particularly from India and China, because it might require additional investment to enable them to make the transition to put into place some of these, of course, treatment approaches that you mentioned, because the environmental safeguards do cost money to put into place, and they may or may not have that in place, and might be very specific to the particular drug as well that they're trying to scale up. And will you be giving them a little bit of extra leeway in the procurement process to enable them to be part of actually any competitive bidding efforts to scale up the manufacture of this important drug?
Thank you, Anthony. I'll try to answer to all your questions. Please let me know if I'm forgetting something. Regarding Shionogi, Shionogi is very environmental focused. And one of the points in the license agreement that they have with us is that the generic manufacturer will also comply with certain environmental standards. Regarding the AMRIA and the Stockholm RAMP project, yes, they are more focused in multinational companies and not so much in low and middle income countries. And this is something that GARP is discussing. if there can be any incentive for a generic manufacturer, for example, in India or China or any other low and middle income country, to bring their manufacturing site to a standard that is both recognized internationally and that will, from the start, prevent the release of the API into the environment. And I'm sorry, I think I'm forgetting something.
Yeah, so I guess I'm curious whether Shionogi actually has engineered the process with discharge concerns in mind as well, because the green manufacturing process is sometimes really something one has to set in the original sort of pharmacopoeial monograph actually for the manufacturing process and how you quality test control the process. The zero liquid discharge, for example, I suspect would be a lot easier if in fact actually this was done with that in mind. And so just curious how much they thought about that, because of course this is one of their, I think, lead antibiotic products. And I don't know how much experience they've had in this particular area or not.
Honestly, I'm not really aware if they engineered the process or not. I can look into it and try to come back with an.
Sorry, I think you muted yourself.
Oh, sorry. What I can say is that they are very keen on complying with environmental standards. But I can look further into it and come back at a later stage.
Great, thanks so much. I mean, it was obviously a very important licensing agreement, so it's great to be able to see that this is also being considered by GARDP.
Yes, thank you.
Thank you so much, Elizabeth. I don't see any standing questions for the moment. Oh no, we do have in the chat. Nicoleta, would you like to present that directly? Or would you like me to read that out?
Yes, I will do so. Hello, everyone, and thank you very much for this very enlightening presentation. I was wondering, my question was that once GARDP is embarking in this or due diligence process, which is definitely due, I'm just wondering that once any given auditing process is carried out and is finalized, who is then in charge of monitoring and making sure that the due diligence is preserved along the time and it's not just a one-shot type of arrangement linked to the agreement? And I'm just wondering whether there is any public entity in charge of this, Ministry of Health or other Ministry of Environment or any other interministerial bodies in charge, or does it stay only with the pharmaceutical company or with the due diligence according to basically a type of voluntary arrangement with the industry? Thank you very much.
Thank you for your question, Nicoleta. So at this moment, GARDP, as I mentioned, will include different environmental conditions in the sub-license for the manufacturer, and we will continue to monitor. Basically, the manufacturer will have to report to us a series of things that will be defined in the license, such as technical failures in the equipment, unscheduled releases of API, incidents, accidents, and non-compliances. We also require that they share with us the audit reports from the environmental management system, as well as inspection reports from the competent authorities in their country. So we will continue to, this is not just a one-time due diligence. We will continue to make sure that stewardship is included along the process and throughout the years.
Thank you, Elisabetta. You're saying, however, that authorities in charge are involved at some stage.
Well, we are not thinking to engage with the competent authorities of the country that the manufacturing site is located at, but we will conduct audits from perhaps once a year. They will have an environmental safety, labor and ethics audit. So that is foreseen in the agreement. You're welcome.
Colleen, you have the last question.
It's a follow-up to Nicoletta. Thank you, Elizabeth. I'm just curious, why are the local health and other regulatory authorities not involved in this exercise? And also whether this kind of information that they'll be providing to Gapi will also be made public? Just wanted to know that. Thank you.
Thank you, Yoki, for your question. As we are still working on our environmental strategy, this is something that is not completely defined yet. We may engage with competent authorities, further along the way. However, I'm a former environmental regulator, and I know for a fact that environmental licenses, they don't set environmental limits for APIs. Therefore, we need to come up with initiatives like the PSCI, the AMRIA, and the PNEX, and establish a threshold and a methodology on the side, basically as a complement to what the competent authorities enforce or apply in their licenses, and try to gather good practices and also identify best available techniques and technologies to keep this moving forward.
Thank you. And the information won't be public for now.
Well, I think the license with Shinogi is public, and I will need to check, but the sub-license will probably be announced as well. I'm not sure if it will be public, but it's a thing to think about, of course.
Thank you.
Thank you.
Thank you, Elizabeth. There's so much for your time and presentation. We welcome for you to stay on and join us, though we know you're traveling. So
thank you so much.
So colleagues, we're moving now to discuss finding and identifying and discussing co-benefits in tackling antimicrobial resistance. For this, our first speaker will be Nafis Faizi, which many of you know from the People's Health Movement. And he will be taking us through a discussion in particular with the co-benefits in relation to our broader health areas, including for universal health care and the challenges that health systems have now more broadly. So Nafis, welcome. Thank you for being with us, and you have the floor.
Hi everyone. Hi colleagues. Am I audible? I must first ask.
Yes, you are.
Yeah, okay, super. So in the next 10 minutes or so, I'll be concentrating on health systems. Let's start. These are the 4 points that I broadly want to cover. One is how AMR drivers have been traditionally linked to universal health care and how AMR and UHC are linked, why PHC is essential for AMR, primary health care, and a little bit on the omissions of the recently concluded people-centered framework for health systems in AMR. So this is relative contribution of different drivers of AMR. This is not based on, this was based on a evidence which had 200 or more doctors and other experts in AMR. So it's not validated in terms of their high, moderate, or low. So, but what we can see here is that most of these, from suboptimal vaccination to suboptimal dosing to antimicrobial use, overuse, all of them have UHC, have a role of UHC. Now, how we think beyond the AMR package, which universal health coverage is doing, adding the AMR package probably, is that quality health systems reduce healthcare transmission through IPC. There is a role of increased health workforce, which UHC can bring us through SDGs and other combinations. And then very recently in the executive board just concluded, there is a provision for IPC, infection prevention control workforce. How this integrates with UHC is still a question, but that is something to watch out for and is very useful. In terms of the infectious diseases, vaccination coverage, expanding on them, access to diagnostics and drugs, because access to drugs limits the suboptimal use as well as substandard drugs as well. In improvement in care continuum within the universal health care. And in a sense that when a patient comes up to a tertiary healthcare center, there must be a provision in the continuum care so that we know which antibiotic has been used already and which haven't. Because currently what is happening is that in many low and middle income countries, there is doctor hopping and doctor shopping. People go to the pharmaceutical sector, to doctors here and there, and take a plethora of antibiotics in many cases. And the tertiary center people don't even have an idea how many antibiotics have been taken. So stewardship and regulation, better use, that is another thing, better use of rational antibiotics, which should include regularly updated standard treatment guidelines. And this can be based on local AMR data within the UHC framework, if that can be made. And then surveillance, antimicrobial usage can best be surveilled within the UHC framework. The WHO Global Survey on IPC, which was the basis for the executive board discussion, did not have 10 most populous countries in the survey. Now, it had fewer countries than the GLASS survey itself. So unless and until we make surveillance something within the universal health coverage and universal healthcare framework, surveillance will become, with this self-reporting based surveillances are not going to really make sure. And then this was best covered by Global Framework, where it said that universal healthcare provides the best enabling framework for addressing AMR in human health. Bloom has, in 2017, in terms of health systems, universal health care, accounted for a lot of these factors integrating with the universal health coverage. I'm not going into those details, and neither do I agree with all of those. For example, the financial incentives to encourage overuse or antimicrobials. And at some places, there have been research where just a couple of months ago, we had a research where financial incentive was tried for under usage of antimicrobials or for proper usage of antimicrobials. So I'm not going to go into that discussion, but AMR, UHC are very intricately linked. We know that SDG 3.8 has direct statements, has a direct connection with antimicrobial resistance as universal health coverage, the access to medicines, access to antibiotics, financial risk protection, and access to essential health service care services increase. A lot of us at ARC were part of this addition of indicator 3D2, which is percentage of bloodstream infections due to selected AMR. So SDG AMR connection is very well highlighted through mainly these indicators. Why we think PHC is integral within the universal healthcare framework is, going into the four basic principles of Alma Ata, which used to take these four as its principles: equitable distribution. Now, access to aware or access, watch, or reserve antibiotic is something that has to be there within the equitable distribution. The care continuum can also be affected there. And what is very important is the current hospitalized-based pyramidization system that must stop. People are not going to primary care. People directly go to the tertiary care because of poor facilities at primary and secondary care hospitals or centers. And therefore, this depyramidization has to happen only if there would be equal distribution and quality healthcare at the lower centers as well. Within the intersectoral coordination, yesterday we witnessed the importance of decentralized waste treatment as well. So WASH, IPC, and education, this has to be intersectorally collaborated even at the lower centers. The third principle is appropriate technology. We need diagnostic support more point-of-care diagnostics, technical support to stewardship through mobile tools and others, as we saw a couple of years ago in the ETG guidelines in Australia. Community participation, which is very, very integral to us. And we have to reduce the AMR information asymmetry. It's just not, I've never understood the fact that people have been suffering from diarrhea since time immemorial. And even then, most of our people do not know that viral diarrhea does not need an antibiotic on the first day. This is not a problem of the people. This is a problem of the health system, that how the health system has not been able to send that message to people even up till now. So if we remove this information asymmetry, then only we can reduce the pressure to prescribe or dispense. We have to also understand that there are normative needs, which we as professionals, as we like to call ourselves, want to impose, whereas the community has different priorities. Unless and until we take into account the community needs, the normative needs for these specific fragmented programs might not work. So community participation in that sense. Let me move on to, this is something that we've been discussing quite a lot, is many of the access antibiotics are not available when they are needed. And the key example is penicillin, where penicillin is either not available or not prescribed due to fear of resistance. And this leads to furthermore increase in resistance in Neisseria gonorrhoeae. I'll move on from this slide. All the elements of primary healthcare, the traditional elements, also have direct implications on AMR. The last bit of my presentation would be on the convoluted route to draft people-centered framework that just came up about a month ago. And this is not to scale. This is just pick points on how things are changing in this fair. Is Almata comes with a primary healthcare concept, a very comprehensive concept. Things happen. World Bank comes in 1993. It says that you have to be cost effective. This pursuit of effectivity leads to very selective package-based approach to primary healthcare. And there is a deliberate confusion that primary healthcare is reduced to primary care. And then World Health Report 2000 finally comes up and does speak about health systems, that all the people and actions are responsible for primary purposes, broadens the horizon. In 2008, World Health Report came, which clearly outlined that there is a huge difference between primary healthcare and primary care. And it was 30 years of Almata, and then 40 years of Almata, another declaration. But now the stage is set for research into more and more universal health coverage, which is more and more package, how to improve the package. And finally, we have the draft people-centered framework. Now, WHR 2008 was key in this discourse also, as it said that we are just jumping from one short-term priority to another. We are fragmenting our health systems. There's no clear sense of direction. And therefore, we'll have these 4 policy areas. And as I was looking at the people-centered draft, I could very much relate how, on one hand, one thinks that, how can you make a patient-centered framework without talking about patients or people, and how this has been possible. And this is how this has been possible, is that for universal coverage, there is AMR package in the people-centered framework. For people-centered services, we've talked only about healthcare delivery there. For healthy public policies, there is a clear-cut appropriation of primary healthcare just to primary medical care in the whole of the draft that we see. And that kind of focus, can be seen in this people-centered discourse as well. When the first the patient-centered discourse comes up, then people-centered discourse. Now, WHO in 2017, they actually talked about that people are participants, and we have to make sure of the expectations of people. People should have the education and support they need to make decisions and participate in their own care. The language is diluted since Almata Declaration, where people had right and duty, or even in Astana Declaration, where people had community ownership. None of this was present in the draft discourse. The key point, and with this I'll end my presentation, is the time has come where the community and the people should be involved in co-designing and implementing, so that, in the community engagement framework for people-centered health services, this was key, and this graph actually highlights that from WHO's own report, is that unless and until they become co-designers, unless and until people's normative and comparative needs as well as unmet needs are taken care of, it would be very difficult to be on the same page on AMR and other priorities as well. With this, I'll end. We know that within the health systems, universal healthcare is integrally related to AMR, and primary healthcare has to be a major component of it to address AMR in totality. That's it. Thank you.
Thank you so much, Nafis. Would anyone like to take the floor to comment or ask some questions?
Yeah.
Yes, we have a request from Nicoleta. Please go ahead, Nicoleta.
Thank you, Nafis, very much for this presentation. I very much share your concerns when it comes to the people-centered framework. I also participated in these consultations, and I noticed that, as you said, people are just there as kind of participants. They are not really part, apart from the narrative, they are not really part of the process. And I just want to, once again, for the record, highlight this comment you made. I think it's absolutely crucial, the more so, because if we are really going to operationalize any still to me transcendental concept of One Health, which is a kind of a metaphysical evocation, but the operationalization of it is at risk at the moment to be going into the hands of the surveillance system once again. I can see that in the pandemic treaty negotiation, and I have my discussions with my colleagues from TWN on how the One Health is being shifted to a domain and an arena where it doesn't really belong. The only way to in a way, rescue One Health is precisely through the idea of regenerating health systems after the pandemic and of course, in the face of the crisis, AMR and other crises that we have, through a process of horizontalization in the way that people are involved, but also in the way that we de-hierarchize all the health systems that we have in the North and in the South, where, doctors are the masters and patients basically are their subjects of intervention. And so this kind of horizontalization is needed for operationalizing better health systems, able to face the challenges, but also to create the entanglement between human health, animal health, and environmental health that only people, community, have a sense of, more than perhaps the kind of experts or professionals, at least at this stage. So I think your point is extremely valid. And I really want to thank you, because this is very valuable also for the way that we will continue to input on the pandemic treaty negotiation. Thank you very much. And sorry for being a bit long.
Thank you, Nicoleta. And I think, Nafis, you also make the case very well for how do we actually bid for financing overall for AMR, very linked to financing primary healthcare and just overall the broader attention to those transversal areas that need support. Because we also see that even for the case for AMR financing, sometimes it's dissected from the root base of what needs to be in place, in particularly in low and middle income countries. So we may sometimes see that as a missed opportunity for actually driving, more interest in saying, well, this can actually, as we're trying to do now, have more benefits more broadly than from very particular areas, for example, on surveillance, right, on building overall infrastructure. Would others like to comment, or Nafis, would you like to reflect back on on this. Nicoletta was I guess more complimenting, but if you'd like to add anything more, let me just check. I think we have another comment on chat. I don't want to miss anyone who's no. Okay, that's fine. No, Nafis, back to you.
Yeah, it's just I guess Anthony wants to say something, and then we can probably reflect on that.
Right, Anthony, to you.
Yeah, no, I think Nafis, a great presentation, and it's so great to see you actually weave this together with the universal healthcare set of issues. Mine's actually more on an environmental dimension area, and a particular strategy and what your reflection is on actually how I know UNEP and others have sort of raised the issue about take-back programs, which are usually considered really in the larger context of essentially collecting pharmaceuticals in general from the community that are unused and therefore oftentimes expired or sometimes expired. I personally have had some very mixed feelings about actually whether or not this is an easy type program to actually implement in the area of antibiotics, in part because, as I think Arturo's on the call now, actually, I mean, he I think very poignantly reminded me that for many, antibiotics, in fact, of course, are saved by actually by those actually in resource-limited areas for the next loved one who actually might need an antibiotic course. And it's perhaps not the appropriate thing to do, but at the same time, actually is a part of the reality actually of how many unfortunately struggle for access in our healthcare delivery system. And at the same time, you know, the environmental message is, well, we can have these take-back programs, which in some ways, in my mind, don't make a lot of sense if you're pushing for take-back programs because they shouldn't be saving the antibiotics to begin with. And secondly, you know, they should be taking the full course, and only the full course should be actually prescribed. And actually then medication adherence would dictate that they would actually complete those courses of antibiotics. So there are very few instances in my mind where actually you would switch, you know, to another antibiotic mid-course and have remaining drugs, especially for outpatient oral antibiotics. At least that's my clinical sense of it. I'm just curious what your take would be on this within this system and approach. How do we actually send the right signal on environment? Because take-back programs have been pushed a lot, and I think they make sense for larger sets of pharmaceutical products, but not necessarily. I'm a little bit concerned about how we might think about this, particularly within the spectrum of antibiotics. So anyway, if you have any thoughts on that, that'd be great. Again, this might be a little bit more off to the side compared to some of the other more issues you've raised, but I still think for the environmental dimension, I flag it.
I wouldn't really comment on the take back program per se, Anthony, but let me do count some of the struggles that we face is in HIV/AIDS program, which is completely free, which is one of the better funded programs, even in India, which is better than many other places. The antibiotics are broken down. We don't have pediatric antibiotics. So the doctors break that down, you know, divide it into 2 or even 3 in some cases, according to weight, and give it to people. This is the reality. And we're talking about these antibiotics, which are off patent. I mean, there is no production facility or there are, you know, the money is not reimbursed in time or whatever has happened. But, you know, with the HIV/AIDS program, this is something that we are witnessing is that, you know, the antibiotics at the right dosage at the right time is not present. And sometimes, you know, you have to really break the tablet and give it to patients. So that is one of the concerns. I would also echo some of the thoughts that Nicoletta was saying. And as I have always been wondering, like a small kid, is that in 1970-78, they were talking about intersectoral coordination. They were talking about water and nutrition and safe water and, you know, how to treat wastewater. All of this was being done with the intersectoral coordination at the lowest level. And therefore, people were theoretically at least involved. Now it has become a One Health paradigm, hyper managerialization of the whole system. And people have absolutely no idea whether there is an intersectoral coordination. What does that mean? And can that be done? This fuels pyramidization. And this is something that we've been saying within the health system is people do not go to the lower centers. People only respect the hospitalized system and they directly go to the tertiary center. For an infectious disease, if you are visiting the tertiary center, it's a problem. Outpatient visit to the tertiary center should be reduced. It should be taken care of the lower centers. By going to the higher center, we increase resistance many folds. And this is something that is happening due to this hyper managerial systems that we have now, where we are not trying to make the horizontal systems, strengthen the horizontal systems quite a lot. That's that, yeah.
No, that's a great set of points. And Vivian, if I could just say, on this area and stuff, it also does, I think, also reflect also in our concerns over the surveillance actually systems and who controls them. And this is one of the questions that was raised yesterday, actually, over whether industry-based surveillance systems, which might be actually more focused on a sampling of tertiary centers where higher use of antibiotics, particularly the latest and greatest antibiotics, so to speak, or maybe the latest, not necessarily the greatest, of antibiotics, the second line antibiotics are more expensive, I should say, might be more frequently used. And so forth, you might register higher drug resistance actually levels in the actual community base. And so you might move inappropriately too quickly to actually a second line antibiotic if you're using those particular antibiograms at those hospitals where in fact overuse of antibiotics is already prevalent. That actually could lead to actually too quickly getting rid of the first line antibiotics that might be used in the community. And so we need to have actually unbiased surveillance systems that reach, as you say, into actually the periphery of the healthcare delivery system where most of the people probably receive their care. But thank you so much for your thoughts and remarks.
Thank you, Anthony. We also have a question from May Murray in the chat. I'll read that out, but if May Murray, if you'd like to then come in, feel free to do so. The question is, does that mean concepts should be developed by people on the ground with everyday language and images rather than by strategists doing it at an expert management level? And this, of course, ties very much with our broader communication of AMR issue that perhaps it's not targeted enough to those who are seeking to address. But maybe, Nafis, you have experience on this at working with communities. I'd like to comment. Thank you.
I guess, Philip, if he would have been here, he would have been excellent at answering this, is that they really started this program within schools in Kerala and a lot of other places in India, where the school children and the community was directly involved in understanding this with everyday language. So actually, there should be a seamless integration. It goes without speaking that the community, why is it not being involved when it is at the center of it? Is yes, there should be more and more AMR champions at the ground level. And some of our youth presentations that IDEA has, we've seen with IDEA, it has been doing pretty well in this regard. And yeah.
Thank you so much, Nafis. So we'll be moving now to Steve Roach. I see you on screen. Thank you, Steve, for being with us from Keeping Antibiotics Working Coalition. And I think some of the aspects that Steve, you'll be discussing, of course, is how do we broadly work with, the consumers' perspective and perhaps some of the One Health elements that have been mentioned now so far. So Steve, to you, thank you.
Yeah, thank you, Viviana. Let me see if I can get my slides up. No. I might just go like that since I can't seem to access the top line to do it. So, okay, thank you for inviting me. Yeah, I'm Steve Roach. I'm the Safe and Healthy Food Program Director at Food Animal Concerns Trust. And we're a member of the Keep Antibiotics Working Coalition, which is a coalition of 19 US-based advocacy organizations looking at antimicrobial resistance. So I kind of wanted to talk about who I am and where my perspective is. So we are US-based, and I appreciate South Center inviting us. I live in Iowa, which is a state that has 25 million pigs and about 4 million people, or less than 4 million people. So we have 8 pigs per person in the state. 70% of our land is in row crops. And this whole agricultural system in Iowa is highly supported by subsidies and lack of regulation. And one of the factors in the agricultural system we have with these 25 million pigs is also very high levels of antimicrobial use. So a lot of the talk that we've heard about and a lot of the focus on antimicrobial resistance in the environment has really looked at kind of genes or the drugs themselves in the environment. And I think that's important. And I think on the agricultural side, really what we're doing now is collecting data and developing surveillance system. I know we've looked for pharmaceuticals in the environment for at least the last 20 years, but it really still nobody, for the most part, knows what to do with this, at least in the systems we have. So I think there clearly we need to improve surveillance in the environment for both pharmaceuticals and resistant genes and resistant pathogens. And I think one of the areas what we've talked about, there's been a lot of attention to wastewater systems of humans, but we also have wastewater, or we don't necessarily have systems, but we do have a lot of waste from animal operations. And I think we really need to think about, okay, what type of surveillance systems can we put in place to address those systems? And I think it should be part of our surveillance for pandemic potential pathogens. So we should create systems where we're looking at food animals and looking both for viral pathogens, but also looking at these dangerous resistant pathogens as well at the same time. And I think that's something that has hardly been done. And I think the example from the human looking at wastewater could give us some ideas of what we could be doing on the animal side. But so now I kind of want to step a little bit back from talking about the genes in the pathogens in the environment, and kind of look at why are we using antibiotics in animal agriculture. And I'm going to focus on animal agriculture. There's growing concern about, particularly with the fungicides, about what's happening in crop agriculture. And I think there are probably parallels there, but most of my work for the last 20 years has looked at animal agriculture. And so I've put up this slide here, which kind of looks at a transition that's gone over the place, probably in the US over the last 50 years. So we had a traditional farm where essentially you had an integration of crops and animals on the same farm, so that the waste products from the animals become fertilizer for the farm. And so it kind of is a circular economy. And in looking at this, I do want to say that we shouldn't idealize any system of agriculture since settler colonialism in the US. These family farms that we think of as attritional farms were basically put on lands that were stolen from indigenous people previous to this traditional family farm system that we have in the US. There were communally owned lands or communally managed lands in intact ecosystems, healthy forests, healthy prairies, healthy river and systems that provided food as well. So we kind of replaced them with this farm system, but this farm system, at least in terms of the nutrient cycling, generally was much more contained. It didn't depend on inputs. So what we've moved to is an industrial farm system, which basically means you use lots of energy to produce crops in one location, and then you concentrate animals together in buildings. This figure shows the animals outside, and that doesn't, most pigs in the US never see the outdoors. They're always inside a building. So when you raise animals this way, what you're doing is you're concentrating the waste. So that creates a waste problem. On the traditional farm, the waste was a valuable resource. Despite what anyone says, the waste in these systems is a waste product. And what we do is we over-apply it to land to get rid of it because it's expensive to move it further away. And so that waste has antibiotics and antibiotic resistance pathogens in it. It goes into our waterways. It also, when you put animals in these systems, and in some parts of the US, particularly like in Northwest Iowa, you're getting back viral. Basically, you have a huge regional area where there's so many animals that viral pathogens spread between the animals readily. Many of the viral pathogens that impact pigs are also immune compromising. So then we have secondary bacterial infections. So and the response to that is antibiotics. In these systems, because of economic reasons, for the pig systems, they'll take the baby pigs from their mother before their digestive systems are adjusted to eating solid food. And again, they manage that with antibiotics. So what you're having is a large number of antibiotics going into these systems. These systems also, in the state of Iowa, pig manure is pretty much has polluted with high nitrogen levels in every river, stream, or body of water in the state. Then there are also big sources of greenhouse gas emissions. So there's all of these problems that are associated with this high antibiotic use system. I would say they're also vulnerable to pathogen introduction. So this kind of concentration means that if you have 1 million birds on a farm or 1 million pigs on a farm, if you get a disease in that farm, you can significantly impact your production for a country. And then I would say another thing that happens in these industrial farms is that they concentrate wealth. So what you have with these very large farms is you'll have maybe a family that owns a farm, but there are lots of marginalized workers working in the facilities, and the wealth goes to very few people in the community. And what we've seen is with this type of farming system in the US is that our rural communities are basically losing population regularly. And there's some to the extent where the communities start no longer being viable. So I think there's a lot of problems with the systems. So the way I see it, if we want to challenge with what we're doing about antibiotics, we need to move away from this system, and that creates lots of co-benefits. So here I've given 2 images of the image on the left is basically a typical feedlot in the US. These systems, again, were cattle. This is cattle versus pigs in the other one. And again, in these ones, all the feed is brought in. You can see there's nothing for these animals to eat except for what it's brought into them. And then on the right side is another system. And I say if we want to tackle it's very difficult to raise cattle and pigs in these kind of confined operations without lots of routine antibiotics. So what we've been promoting, my organization, is kind of looking at more regenerative systems. So how do you move animals back out from these concentrated systems, mix them into crop-related systems, and then for the cattle, more pasture-based systems. But I think for tackling AMR, there's 2 ways to address antibiotic use in farms. You can raise less animals or use less antibiotics for animals. And I actually believe in the developed countries, at least, and particularly in the US, we probably need to produce way less animals, primarily for climate change reasons, environment reasons, and then also because that would be a reduction in the amount of antibiotics that we're putting into our environment and using it. So I think there are issues where in other countries where maybe we need to increase animal production, but how do we do that in a way that doesn't create all of these other problems with excess nutrients, antibiotic resistant problems, climate change problems, concentration of wealth, harm to the communities around those? Because if you live next to one of these big facilities, you're going to be constantly impacted by the air quality, the water quality thing. So we've looked for trying to develop more regenerative systems in these looking at that have some potential. There's a lot of discussion in the US about carbon capture in soil. So some of these pasture-based systems are better at that. They're clearly healthier for animals. We work with thousands of farmers in the US that are looking at more intensive systems or extensive systems that don't need to use antibiotics on any basis. They rarely have to treat animals. And then it's also these systems can be less reliant on energy intensive inputs. And one thing I want to say is we're not, and what we really need to do, I believe, is to find a way to better manage our pasture-based systems so that we can increase productivity on them. And there's a lot of effort right now to figure out ways to do that. Increasing stocking density, moving animals more frequently actually makes healthier pastures. And then I think if we have more of that, there's also a need for distributed processing. So what we have with the concentrated animal feeding operations, those big CAFOs, what we have is they're also located next to where we have very large processing facilities. So we have this other concentration of pollution, and a lot of the health impacts are put in small areas. So I think that's what we're thinking about, is how do you diversify our system, return animals back into the landscape and integrate with the farming system. I think another thing we're thinking about is again, I talked about before it was replaced by our kind of family farm system that we have, the traditional farm. There was indigenous systems, and I think there is a move back to try to recapture some of the indigenous farming system. There's been a lot of work with bison and how that is actually can be very healthy for ecosystems, as opposed to cattle, which are an introduced species. And I think at the end, I really like what Nafiz was talking about, people-centered systems. And I think, and again, it's really hard in the US to think about this is that we really need to think about people-centered food systems. And we shouldn't think of the producers and the consumers as a separate group of people. If we could think about how do we have them as integrated, where there is like communities are making decisions about how the food that's produced for them it continues to be produced. And that's a way where you can have, culturally appropriate foods that are healthy. And it also addresses some of the concerns that we have, is that if we have these really beautiful pasture-based systems, but if it's too expensive for a large numbers of the community members to actually access them and afford them. So if we're just using our existing model, where those that have enough money are the ones that get to eat the good food, then we have a problem. So I don't have a lot of solutions to how to do this, but I think we really need to look at how we subsidize the system we have. It is not natural. It's based on an extreme amount of subsidies. It's based on a lack of regulation. So you can, you basically externalize the cost. And then how would we have more support for community control over their own food systems is really, so I thought Nafiz's talk was just beautiful because it's talking about community controlled health systems. Really what we need is community controlled food systems as well. And those things are integrated together. We're struggling with how to do that in the system where we have, so many of these animals are in these huge systems controlled by very few people, very few corporations doing the slaughtering. And one of the things I hope, and particularly in talking to the South Center's audience, is that people can think about where there are more intact food system, more intact local food system. How do you keep from transforming into what you see on the right here and keep people able to have enough food? So, and with that, I think I'll end it and just show some pictures. These are photos of animals on the farms that we work with.
Thanks a lot, Steve, for your presentation. One thing I'd just like to follow up with, and I take advantage of my role now, is if you could tell us a bit about some of the important work that you've been doing, for example, with the chain reaction report, if you could draw some lessons from that work, as well as with the consumer scorecards on food buyers, and whether you see some opportunities for transnational efforts that would go beyond the US in applying, for example, these consumer scorecards.
Yeah, I think essentially for consumers to be able to make decisions and to have impacts, they have to have information. So what we spent was for we have had 6 scorecard reports starting in 2015, looking at the policies. Most of the first 6 were looking at the policies of the top restaurant chains on antibiotic use, whether they had policies. And so because these are very big buyers of meat, they are able to kind of have some impact on the livestock producers. So through that process, where essentially we'd survey the companies, ask them on their policies. We'd also have hand in hand, we'd have campaigns targeting the companies. And then through that, we would get them to adopt policies. And what that has resulted is that most poultry and most chicken in the US now is raised without antibiotics. They're still in the confined operations. I think it's something that's easier to do in poultry than it is in beef and cattle, at least in the US systems that we have. I think they're, in the UK, they use not very much antibiotics in their beef cattle production, but in the US, we use quite a bit. So it can have an impact. We are struggling. I believe what has happened now is that in response to our efforts through the consumer thing, there's a lot more coordination between the companies. So we're having a lot less success on beef and pork with that. I think internationally, I think the Center for Science and the Environment has done some work on this with their with some of their reports on that. And so I think those can be very effective. I think it's a way that consumers can put pressure on the food system to make change, and that we have done that, and those are ongoing processes. Our last one, we started looking at the grocery chains, but we've struggled a little bit there, because what the grocers do is they'll sell a very tiny portion of the produce, of the meat that they sell, as with a label, so for a higher price. And then so the people that are demanding that get those, and it's harder to get change. So we're trying to find strategies to work around that as well.
Thanks, Steve. And we also see, for example, even for export production, that many developing countries, there might be better standards, but only for the exports, and then for domestic markets and communities will just not get the same standards anyway. So there is an issue of price, but also perhaps of what are the controls and incentives as well. So I think this gave us a great setting, in particular, to see the big picture issues, as well as how the productions or the value chain sort of set up, as Anthony brought us since the beginning, is a good way to analyze some of the issues, and then for us to seek together solutions from the civil society groups and different work that's being done, how to tie these together, which brings us then afterwards to the session, in particular, of how do we complement with perhaps other movements that can support this one as well. Just like to note if others would like to make comments or ask any more questions for Steve. We had some great support, Steve, for your presentation in the chat, as you can see. I see no show of hands in the moment, so then we'll be moving forward. Let me just take a look. Okay, so according to our planned time, I would suggest that we move then to discussion on what we can learn across movements on AMR, and we have several experts here working across issues, which will really help enlighten us in that discussion. So to start that off, and of course, Steve, thanking you and inviting you to keep on in the discussion as we go along. We'll start by inviting Yokeling Chi from the Rural Network to give us the first broad perspective on the issue of how can we find connections to other movements as well. Thank you.
Thank you so much, Viviana. I have a few slides. If I could share screen, please.
Yes, you should be able to do so.
Okay, thank you. Right, can you see that? Okay. So you can see my screen?
Yes, would you like to put
okay, thank you so much. I'll put it on full, yes. Hang on. Okay, right. Thank you so much. Yeah, honestly, yesterday's discussion and also what we've heard in the last couple of sessions really shows how much we need to bring together the different processes where civil society is active, and not just civil society, but also I think many of our government policymakers and negotiators are also involved in many of these spaces that I think we could connect and bring AMR into those spaces. I want to just quickly run through my presentation to look at the kind of work being done by different coalitions and campaigns, all of which share a common framework of human rights and equity. Yeah. Okay. So basically, I'm sort of picking up a few. We don't have time to go into details about each of these different aspects, and there's more out there. So I just want to highlight a few of the different pieces of work going on. Some of them are the emerging movements. Others are actually advocacy interventions at different levels. But basically, what really brings these different pieces together of what I want to share is, I would say, precautionary principle, polluter pays principle, common but differentiated responsibilities and equity. And emergingly, very much a very important piece is just transitions, and we talk about transformative change. And then, of course, pushing back corporate capture. This, I think, are some of the key elements around which the framing of rights and equity within and between countries is actually sort of forming the advocacy and interventions of a range of coalitions that bring together community groups, civil society, academia, people who are former UN, international multilateral agency expertise, and also former people, former government people. So when we talk about movements, we have to really recognize it is a coming together of that range of civil society in the broader sense. And there's a lot of intellectual rigor going on that supports the interventions. So this is very important, because I think the connecting the understanding of the environmental implications of all the different actions is a very key part of it. So as we have also heard from the last sessions, yesterday and today, there are differences in realities and levels of development, in capacities and resources among countries, especially the South-North divides, yeah? And of course, the diversity of coalitions. I want to just highlight a few that we could think of where AMR may not consciously be in their agenda, but I think awareness building that we have talked about a lot, especially in our antibiotic resistance coalition, ARC, many of us are here in this webinar who are part of that coalition. We have been trying to sort of say, how do we actually get the message across? Because the comprehensive nature of what creates AMR and the responses to AMR is systems-wide. Yeah. So I just want to highlight where there could be possibilities of us reaching out. For example, there are many, many CSOs and coalitions over more than 25 years engaging very actively with the Sustainable Development Agenda of the United Nations. It started off with the 1992 Rio Conference on Environment and Development and the Earth Summit, where we brought together environment and development within the framework of the Rio Declaration of Principles. So what I put on the heading here in terms of precautionary principle, polluter pays, CBDR, are all part of that 1992 North-South Partnership Compact of states with a lot of civil society, particularly from the South, participating in that process. So the continuation of that, which led to the 2030 Sustainable Agenda and the 17 SDGs, and I think Anthony, sort of gave us the picture of some of the interconnectivity of the sort of indivisible SDGs as they are with human rights. They are a package. So we have coalitions and a lot of CSOs who are very experienced in engaging with the Sustainable Development Agenda at the UN New York site. And the high-level political forum is actually a very active convening every year of governments and civil society. And also, of course, there's ECOSOC and all these different bodies and subsidiaries. And also more and more, the UN General Assembly is actually where different interests, from states to corporate interests to civil society interests, wanting to raise a higher level of political commitment by getting resolutions out of the General Assembly every year. So for example, this year, there's going to be something on universal healthcare and health. So, how do we get engaged? How do we monitor? So this is one area I think we need to consider. And for AMR, we had, after the WHO had adopted the strategy, efforts were made by many of our colleagues here and outside to input into a resolution to give momentum, political momentum, to the implementation of the AMR strategy, right? So then you have a very important group, and I think the campaigns that we have had in many countries that are also coming up again against genetically modified organisms and to promote biosafety Concerns over horizontal gene transfer AMR has been in the scientific discussion and among a number of the civil society groups working on GMOs and biosafety. So here is a coalition of CSOs, scientists, farmers groups, whom we could actually also be working with, because AMR has actually entered not in a broad enough way, but is part of the discussion, at least among some aspects of these campaigns. And just following up on what Steve had just said, absolutely crucial, because in the One Health proper analysis, the agriculture part of it is so crucial. If we don't change the health systems, we don't change the agriculture systems, we are going to just spill over into major environmental impacts. So the agroecology movement and food systems movement is really, really active, very much from local to global. And I think that the one partner we could consider is actually the International Panel of Experts on Sustainable Food Systems. This was founded by Olivier de Schutter, who was for many years the Special Rapporteur in the UN on the right to food, and is currently also the appointed in 2020 as a Special Rapporteur on Extreme Poverty and Human Rights. So I think that and the people involved in this are from academia, from civil society, from people who are in government, from the UN system, and they are producing really, really good reports. I think if we can get them interested in the connection with AMR, it would be a very, very good partnership to have. And of course, demand climate justice is one of the more prominent, at least from the Southern perspective of Southern voices at the global level, is the Demand for Global Justice Coalition. And this one looks at, of course, a lot of transition issues with energy systems, with equity and justice, and they're very, very engaged so outside forces for the UN climate negotiations. They are not looking at AMR as such, but the awareness that there is, of course, connection between environment, climate impact, and disease and health is there. And I think we should actually really engage with them. And a number of our partners on the AMR front are also members of the Demand for Climate Justice. So this is certainly a movement to tap into. Then I just want to focus also on the Break Free from Plastic, which is really, really energetic global movement launched in 2016. And they were actually envisioning a future free from plastic pollution. Today, there are more than 12,000 organizations and individual supporters, and they have worked together, and they're part of this larger coalition for Global Plastics Treaty. And we know that UNEP recently actually adopted a resolution in the mandate for negotiations of a treaty to phase out plastics. This is going to be looking at consumption, the whole life cycle of plastics, production, fair transition, just transition. It's a very challenging thing, but the activism around it has been tremendous. And I think that this is really, we were talking a little bit yesterday, I think, again, Anthony had raised the issue of microplastics as a pathway for transmissions of antimicrobial resistance. So this is a really, and they're not looking at AMR at the moment, although some members of these movements are also part of the AMR community. So I think we should actually also look at how we can relate to them and work with them. The International Alliance of Waste Speakers, I thought about this really literally, and I was listening to yesterday's discussion, where we talk about the informal urban sector, especially in the South, being such a hotspot for AMR, accumulation transmission. And this alliance is really, really amazing. They started in 2005 in Latin America with 4 countries. And today you can see the list of countries I've put there, where these are waste pickers who really are the ones who are going out there and wading through the most toxic, kind of waste out there in our mostly municipal and urban waste. But they've organized themselves about their rights, and they are very involved in the Break Free from Plastic campaign, but they are themselves actually the workers in that system. And so there's also then a group called the Friends of Waste Pickers, who've been working together with the Rights of Waste Pickers over the years. And they have transitioned to call themselves a Just Transition Initiative. So they're working, so the Waste Pickers Alliance is very much part of the Break Free from Plastic. And they are looking very, very concretely into how do you do just transition. Just as the climate justice movement is looking at just transition, when you talk about moving from fossil fuels, what does it mean in production, consumption, and decent, dignified work? So the issue of transformation and just transitions is a very key part. And we've talked about that in AMR discussions in One Health. when we talk about shifting from industrial animal production to a more sustainable production, what do you do with workers who are affected? At the same time, the resistance that comes from the corporate domination has also to be addressed. And these are the different movements, at least a picture of them that looks at these issues. Now, very quickly, I want to move into the area that we have not talked about so much, but more and more coalitions and campaigns are looking at how do we frame all that we do as a human rights issue. So the human rights procedures and mechanisms are increasingly being used. The women's rights movements have used it for a long time. And it is actually going to be something very exciting, because everywhere I've been going the last maybe 2 to 3 years, there's a lot of talk about how do we use existing human rights instruments, procedures, and mechanisms to be able to really push everything that we do as a matter of human rights in a very comprehensive way, which includes human right to development and all the different aspects of human rights as a bundle. So here, engaging with the Human Rights Council, the Secretariat is, of course, the Office of the High Commissioner on Human Rights, and the OHCHR is actually based in Geneva, as you all know. And we have this really big group of special rapporteurs who have been, over the years, they are appointed by the Secretary General, independent people. Most of them we have worked with in different ways, all of us, in civil society, but we worked with them in silos, right? So basically, we need to think about how to use these mechanisms and these individuals in the human rights regime to further the issue of AMR as really an aspect of human rights. So one of the most important special rights recently recognized in 2021 is human rights obligations relating to the enjoyment of a safe, clean, healthy, and sustainable environment. And I quickly put a few of the rapporteurs here that actually would have the interconnectivity for us to think about framing AMR. These are, for example, the climate change, a special rapporteur. You have, of course, safe drinking water and sanitation, health, right to food, and of course, hazardous waste, and there are many others, and we should really explore this, I think, very seriously. Just quickly to focus on the right to clean, healthy and sustainable environment. This is really quite a seminal historical achievement. This was only in 2021, and then the General Assembly also adopted a resolution that this is a fundamental human right in the Library of International Human Rights, recognized human rights. And so this is something that we need to look at, and it talks about how recognizing this right will serve as a catalyst as well for systemic and transformative change to produce a just and sustainable future in harmony with nature. This fits into how we would like to also think about One Health at the local level, as reminded by Nafis and Steve just now. So the mandate is very broad. Just sharing this with you, the mandate talks also about challenges, gaps. And so how do we use this so that we can put the narrative of AMR into this context, right? It's a bundle of rights, not just environment. And lastly, just to point out that when COVID hit, the Office of the High Commissioner for Human Rights also started looking at COVID-19, and they actually produced policy guidelines. And there was a particular one on COVID-19 and the environment. And there they were focusing on how do we look at understanding this big thing with the pandemic. How do we then deal with evidence-based preventive action? How do we avert future global threats, including pandemics? And how do we then look at the environment connection? And I think, again, the way we understood COVID-19 is the way we need to understand AMR as a major silent pandemic. So I'll just stop there because this is some thoughts thrown out tonight, my time tonight, for us to think about. Thank you very much.
Thanks, Jocelyne, first for giving us some of your nighttime for this session, and for your presentation to be so comprehensive. You did such a great job of rounding together a great variety of movements, initiatives from different areas, and really then putting it together for us to then, for this discussion, consider what can we learn on the one hand of what others have been doing, but also how can we enlist part of these movements also. So both learning and also providing potentially a new space for some of these groups to also enter into the AMR space. I would suggest that we take the questions together with the three presentations. If Jocelyne, you can stay on, I know it's later for you than everyone else, but perhaps because here we'll see common themes. You crossed over all around themes. And now we'll be hearing, on the one hand, we'll have more on the food production side, theme with Javiera Calisto, who I see on screen, and then with Arturo Quispe from REACT Latin America, which I think can provide us with a great informative sense of how do we change a bit this narrative of the One Health AMR approach that's being led versus what would be more a holistic approach to this as well. So we'll continue and just keep your questions for Jacqueline as we'll just do the two presentations. So with that, I'd like to turn to Javiera Calisto, who's from Oceana, Chile. And Javiera, you have 10 minutes. Thank you.
Hello, Viviana. Hello, everyone. Thank you so much for this invitation. Can I share my screen?
Yes, you can do that.
Okay, can you see my presentation?
Yes.
Perfect. Okay, so I will be talking about a campaign run by Oceana in Chile against the salmon farming industry. And the aim of this campaign was to ensure transparency in the use of antibiotics and other pollutants used by the salmon farming industry. So something that we have learned is that access to information and transparency, it's really relevant in an industry it's regulated. First, because transparency encourages competition between companies. And this can really lower the use of antibiotics. This is the reason for this is because today, when you see the Chilean market on salmon, you only recognize Chilean salmon. You don't really recognize different brands and the use of their antibiotics. One big learning that we had is that when we compare the prices of salmon coming from Chile versus the salmon coming from Norway, consumers are willing to pay at least three times more when buying a salmon that comes from Norway rather than a salmon that comes from Chile because of the environmental standards used in each country. And particularly because consumers understand that the salmon that is produced in Chile uses huge amount of antibiotics. Particularly, it uses 500 times more antibiotics per kilogram that is produced. Accordingly, the consumers want to pay more for a salmon that has been produced without antibiotics. And so by knowing how much antibiotics is used per company, we can really make a difference because we can tell consumers that some salmons that is produced in Chile, it's different than others. Not all salmons that is produced in Chile uses the same amount of antibiotics. So by knowing, by making accessible and transparent the use of antibiotics per company, we can actually encourage the competitions between companies and make them reduce the amount of antibiotics used. So this is the effect on the private companies in the salmon farming industry. But on the other side, we also know that the fisheries superintendency in Chile, which is called the Fisheries Service, has different obligations regarding transparency. So each company in Chile has the obligation to inform the fisheries services how much antibiotics is used per production. However, something that we have learned is that the fisheries service is really not doing anything with the information that it's being provided. We have requested this information and they have the way that this information is held is not organized, is not properly managed, and accordingly, there are no consequences in the use that this information is given. We know that scientists, universities, policymakers, or even citizens could really react differently according to the way this information is being used. And today, the fisheries services is not giving an effective use to this information. And so by knowing particularly how much antibiotics is being used per company, per region, this really will allow the development of research and improvements in global governance in the use of antibiotics in the Chilean salmon farming industry. So for all of these reasons, we have really worked very hard to access to the information in the use of antibiotics and the information disaggregated per company and per, which means that each company will have to give the information per each center. And so this will give us a map on the use of antibiotics in the southern regions of Chile where the salmon is being produced. So as I already mentioned, Chile uses around 400, well, it changes every year, but around 400 times grams of antibiotics it's used per each ton that is produced. So when we compare Chile to Norway, this is a really important difference. However, companies have never wanted Oceana to access to this information. So since 2014, Oceana started asking this for this information to the Fisheries Service. So we have a legislation that establishes that every information that is held by the authorities, it's presumed as public. So this means that any person, and including NGOs, can request to this information to the authorities. However, the companies have the right to deny. And the arguments that the companies have provided to deny the access to this information is because this could harm their economic or commercial rights. We have challenged this opposition in different courts, and we went to the Council of Transparency, the Court of Appeals, the Constitutional Court, and the Supreme Court. All of this judicial process took us around 4 years to access to this information. Finally, the Supreme Court ruled in favor of Oceana, saying that it's a right for people to access to information that could have an impact on human health and the environment. And the court recognized that knowing how much antibiotics is used per each company, it's something that is relevant for human health and for the environment, and therefore this should be prevailed. The access to this information should be prevailed. And also, one of the big findings of the court is that knowing how much antibiotics is used per company does not affect their economic or commercial rights. Because particularly, for example, in Chile, the antibiotics that are permitted to be used are published. So there is no economic secret when accessing to this information. Every company can use the same antibiotics. And another thing that it was relevant is that we are not asking how these antibiotics were applied to salmon. We are just asking for the final result of how much antibiotics you're using. So there is no secret or in knowing this information. There is no intellectual property that is going to be harmed because of accessing this information. However, even though we had this big victory because the court gave us the information, as I said, it took us 4 years to access to this information. So this was not very useful because you want to give the consumers information that is relevant for them. If you tell consumers, okay, this company used antibiotics, used this amount of antibiotics 4 years ago, for a consumer, it's not relevant. So we needed to have a law that could give us this information immediately. In this slide, you can see the different ways we use the information once we access to it. So some of the things that we did is that first we compared Chile to Canada and to Norway. Also, we compared the informations highlighting the best companies in use of antibiotics. This is the ones that use less antibiotics. We also did a ranking on the companies using more antibiotics. And we also did sort of like a transparency factor in the sense that we also compare how willing were the companies to give this information. But as I said, this information was too old because it was 4 years old. So what we needed is to pass a legislation that make this information publicly available in a permanent basis. So after a very long time, after 4 years working in Congress, this January, we managed to pass a legislation that establishes that the Fisheries Service must publish this information in the use of antibiotics monthly. So now we can really understand and inform consumers about the use of antibiotics per each company. So this is a very brief summary on everything that we did. So I apologize for giving a lot of information very shortly, but basically, this was the way that we make the companies to be publicly transparent. Because with this law, we know how much antibiotics is used per each company, and this will be able to make consumers take better decisions when buying Chilean salmon according to the use of antibiotics. Thank you very much, Vivian.
Thank you so much, Javiera. And you made that such an important point for civil society organizations and work, which is, that fight for transparency and for accountability, both from pharmaceutical firms and private sector actors, but as well as from the state actors as well. And we know that on antimicrobial resistance, this is a big area where we still have enormous gaps. And even with the processes of multilateral institutions, such as the World Organization for Animal Health, for example, that a lot of the data that's even provided at country level is still not accessible for countries. So great efforts and an example of what Oceana Chile through the years has achieved for fighting with transparency and accountability and the fight for information to have. So Javiera, same comment as I made before, we'll take questions and comments after the third presentation of the segment that I'd like to invite Arturo and Arturo Quispe from React.
Buenos días, lindo día, linda noche para todos. ¿Podría compartir la pantalla, por favor?
Sí, claro. Just for everyone, Arturo will be speaking in Spanish. So if you wish, please go to hear it in English. Just go to the interpretation booth and change to the English channel. Otherwise, you can continue in the original audio. Gracias, Arturo. Puedes compartir la pantalla. Sí, la estamos viendo ya.
¿Sí se puede ver?
Se ve muy bien, gracias.
Buenos días, muchas gracias nuevamente a South Center y a todos ustedes por la amable atención. Me voy a referir fundamentalmente a nuestra historia, la historia de React Latinoamérica en la búsqueda de conexiones para enfrentar la resistencia a los antibióticos, la resistencia a los antimicrobianos desde una perspectiva tanto local, nacional como regional. React básicamente en América Latina se guía por dos principios en relación a la lucha o el enfrentamiento, a la contención de la resistencia a los antibióticos. Por un lado, la convicción de la necesidad de la participación de la comunidad, la necesidad del empoderamiento de la comunidad y por otro lado que ese empoderamiento se exprese a través de la movilización. Nosotros decimos, sin participación comunitaria no es posible cambios sustentables. Decimos, sin participación comunitaria se pierde el corazón de todo proceso de resistencia social y desde luego también en el enfrentamiento a este problema global que nos afecta a todos. Desde esa perspectiva, desde ese modo de ver, de mirar, React desde su inicio, hace más de 15 años, viene trabajando con las organizaciones comunitarias y buscando esos nexos que nos permitan abrir diálogos para conectarnos, pero también diálogos para compartir, desde los diferentes puntos de vista, desde los diferentes intereses y desde las diferentes aristas que tiene la resistencia antimicrobiana. Ya en la fundación mismo, en la creación, en la declaración de Cuenca en el año 2008, señalábamos de que el problema en sí no son las bacterias, sino nosotros mismos. En esa declaración decíamos la destrucción de la madre tierra y del cosmos por una sociedad, un modelo de consumismo establecido a nivel global, destruye todos los lugares y ha destruido inclusive los lugares sagrados de las diferentes formas de vida, al decir de nuestros pueblos originarios, de los Andes en especial y de la América Latina en general. En ese sentido, si nosotros reconocemos que la resistencia a los antibióticos es una amenaza global de la salud que afectan a todos, pero en especial a los países pobres y dentro de los países pobres a los más pobres todavía, la magnitud y la multiplicidad de causas del problema implica también la necesidad de una acción coordinada, de una estrategia coordinada, integral, multilateral, multisectorial. Es así que nosotros iniciamos desarrollando actividades que permitan, en primer lugar, el poner o el establecer una alerta tanto social como política. Al mismo tiempo, nosotros establecimos e iniciamos un programa de promoción de salud, pero buscando el apoyo de las universidades. REACT nació y ha crecido y se ha desarrollado en alianza con universidades de distintos países de América Latina y su sede también fue inicialmente la matriz de la Universidad de Uppsala. Tomando desde esa perspectiva, hemos considerado de que involucrar a la academia, involucrar a los activistas sociales y a los líderes comunitarios constituye una de las conexiones importantes que tenemos que ir construyendo, que tenemos que ir desarrollando en función de desarrollar esta perspectiva. Las estrategias que nosotros establecimos en la búsqueda de estas conexiones, en primer lugar, partimos de los movimientos ya existentes. Es decir, una base sostenible a través de los diferentes grupos de organizaciones y colectivos ya existentes. Unos trabajando en el derecho a la salud, otros trabajando en el derecho a la alimentación, otros grupos trabajando en la defensa de la biodiversidad, de la soberanía alimentaria, el derecho a un ambiente saludable, el derecho a las fuentes de agua pura como elementos sustanciales ligados a la salud, fueron la base de nuestro trabajo. Y en segundo lugar, la construcción y desarrollo y al mismo tiempo la consolidación de un colectivo trabajando en la resistencia antimicrobiana. Todo ello orientado hacia un punto básico de unión, que es la recuperación de la armonía de los ecosistemas. Es así que nuestra filosofía recoge justamente los conocimientos y valores de los pueblos nativos. Con razón veía ahí hoy la fotografía, la ilustración de la agricultura tradicional, ¿no? Que en los pueblos andinos lleva el nombre de chacra y que tiene justamente donde en la chacra se reúnen todos los conceptos, todos los principios y valores justamente de lo que sería una sociedad armónica, equilibrada, los principios del suma causa, del Pachamama, los principios de la madre tierra, el considerar a la salud planetaria, la salud de la tierra como esencial para la salud de los animales, de las plantas, de los animales y del ambiente, así como de todas las formas de vida en las que están los seres humanos, pero también están estos seres microscópicos como son los microbios, bacterias, hongos, parásitos o arqueas que constituyen justamente el mundo microbiano y que tenemos que darle un enfoque diferente. Entonces, consideramos que la resistencia a los antibióticos es un problema global con aristas económicas, políticas, sociales, Y al mismo tiempo iniciamos nosotros desarrollando actividades para involucrar, para entender y desarrollar nuestras agendas, orientadas fundamentalmente hacia la promoción social política y el despertar y la conciencia ambiental para poder entender justamente todos los efectos y los impactos que la resistencia antimicrobiana, que la RAM, tiene sobre la salud humana, animal y sobre las otras formas de vida. Nuestras acciones han estado orientadas, ya indicábamos, a la investigación. En general, las evidencias, tanto locales, hemos constituido dinamizadores, energizantes, facilitadores de procesos, porque sin evidencias resulta muy difícil de tener, mostrar la razón y a la ciudadanía, a los gobiernos, etc. Entonces, investigaciones que muestran, por ejemplo, el grado de contaminación de nuestras aguas como consecuencia de la contaminación de los ríos, de la agua subterránea a causa del uso masivo de antibióticos en la cría intensiva. La necesidad de cambiar los programas de formación en las facultades de ciencias de la salud humana, animal, en ciencias de la vida, en la biología, constituye también un eje importante en ese sentido. Y la educomunicación, que cruza justamente todos los espacios y que cruza todas las organizaciones y que ha sido el punto para ir descubriendo qué nos une y qué no puede ser procesos que nos están provocando la separación. Las estrategias entonces comenzaron con la cooperación entre la academia, la comunidad y los trabajadores sanitarios. La participación de la comunidad, la organización de la comunidad y la movilización. La construcción, el fortalecimiento de redes de trabajo y los procesos de comunicación que incluyen absolutamente a todos. Para nosotros ha sido de gran valor el involucramiento del sector de la cultura, del arte, no solamente por la riqueza que tienen en este ámbito nuestros pueblos ancestrales, sino porque constituye una herramienta esencial que permite justamente la movilización, la organización. En ese proceso hemos ido observando e integrando esto de reimaginar la resistencia, es decir, a un principio como un grupo internacional que involucra artistas, que involucra en nuestro caso estudiantes de ciencias de la salud, estudiantes de arte, con el propósito de mostrar y de sensibilizar a la ciudadanía, a la población, a los diferentes colectivos, el rol que juegan las bacterias. Es decir, en el proceso de la resistencia antimicrobiana no puede ser considerado solo un actor, llamémoslo así. Los antibióticos son virus, salvan vidas, pero cuando la población entiende que estamos frente a otro sector que son las bacterias, que son los microbios, que también preservan la vida y son esenciales para la vida, entonces surge la idea del uso racional, del uso apropiado. O sea, esta ha sido una de las estrategias muy importantes en la búsqueda de las conexiones, de las interacciones y de las interrelaciones con los otros actores y con los otros problemas. El rol que juegan la escuela, los maestros, aprendiendo y enseñando a sus niños, a sus niñas, el mundo microbiano, los roles que juegan los microbios, entendiendo que los microbios juegan roles esenciales y que tienen que ver con el cambio climático, que tienen que ver con la fertilidad del suelo, que tienen que ver con la salud humana, y dependiendo del principio de la diversidad, de la biodiversidad como un elemento esencial. Biodiversidad como elemento esencial para la preservación de la especie humana, biodiversidad como elemento y con diversidad bacteriana como elemento expresivo de salud humana, de salud animal, de salud del suelo. Y han sido esos elementos los que nos han ayudado a ir descubriendo. Entonces, los maestros de las escuelas, los artistas, la cultura como elementos esenciales. En ese panorama es que se han desarrollado diversas actividades, como por ejemplo la que mostramos en esta diapositiva. Jóvenes estudiantes de medicina aprovechan sus periodos vacacionales para visitar los diferentes sectores de la costa y para promover el uso de la bicicleta, para la preservación de un aire libre, de agua pura, y sin duda esto se convierte también en un elemento aglutinador. Cuando los campesinos recuperan y conservan sus fuentes de agua y los lugares sagrados de los pueblos ancestrales, sin duda también están haciendo una contribución a la preservación de la salud planetaria, y al mismo tiempo van entendiendo la importancia de esos seres microscopios y de la necesidad de preservar la salud de la microbiosfera. Ese ha sido el camino recorrido, y en ese camino recorrido han sido múltiples actores, como ustedes pueden observar en esta diapositiva, en los diferentes que provienen de diferentes backgrounds, que provienen de diferentes actividades y que en definitiva nos hacen ver que el problema de la resistencia antimicrobiana es un problema absolutamente que nos compete a todos, a academia, a educadores, artistas, investigadores, a la ciudadanía en general. Nosotros hemos venido planteando de que un elemento esencial en la lucha, en la búsqueda de estas conexiones, constituye justamente el construir una nueva metáfora para los tiempos actuales. Esa nueva metáfora la venimos promocionando, es el danzar con las bacterias. Y para danzar con las bacterias necesitamos entenderlos, conocerlos, ver sus riesgos, pero también sus virtudes, es decir, establecer un ritmo que permita justamente caminar a la humanidad con estas otras formas de vida invisibles que forman e integran como nosotros el tejido de la vida. Danzando con las bacterias fue uno de los proyectos con apoyo de la OPS que fue lanzado el año pasado y que constituye una obra artístico musical donde los saberes, los principios, los valores de los pueblos ancestrales son expresados a través de la música, la danza y las artes visuales. Muchas gracias.
Muchas gracias, Arturo, también por dejarnos con esta linda imagen. Voy a pasar a hablar en inglés. So thank you for 3 presenters in this session, and we really, I think, got a great overview from different perspectives, both on the connections with many other movements outside those institutions working already on issues of antimicrobial resistance, or antimicrobial resistance and the environment already tied together, but also about different views and understandings of who have to be part of the actions and the conversations with. I think it's really valuable. I think picking up from Arturo's last point as well of the involvements also of, we had already talked about communities, but also of others, including young people, artists, and so forth. I will be basically now in this last few minutes of discussion, because I know we've come to time. So for those that can stay a little bit, maybe 10 more minutes, that we can just take together, if you had questions or comments from our previous speakers, if you can also perhaps reflect on what is our last question that we had for this session, which was on, where do we go in terms of strategies and next steps? There's many issues, but if we can focus on those aspects of linking the environmental dimensions of AMR into thinking from those that are already in the movement and those we could gather, what have been for some of you, critical reflections of points that you can say, what specific activities or approaches could we take forward? So ideas we can gather. And from this, of course, it won't be exhaustive, but it'll lead to, we hope, subsequent sessions that we can have more focused on these issues. As you know, our coalition already does a lot of these dialogues as well. So that's, of course, a platform for continuously having these discussions between the group members, but also to invite others to join. So just like to open the floor now And we'll just be taking hands as you reflect both on what our colleagues said, but also your ideas. Thank you. Nicoleta, you have the floor.
Yes, I'll break the ice again. Well, of course, thank you for this very insightful and inspiring presentations to all of the three of them. And there's a lot to do. Certainly, there is a lot to do. Of course, this is very much a coalition's responsibilities, our individual organizations' responsibility. And I think it is a responsibility of reaching out to other groups and constituencies, as Jacqueline was saying. We cannot take for granted that other civil society groups are aware of this. I mean, I'm actually experimenting. I have experimented this over the last year, since as a Society for International Development, we started, devoting more attention on this. We are on the financial justice arena. We are on the food arena. We are on the health arena. But even in the health arena, there is a very biased interpretation of what this AMR thing is all about. And, it's all about human health. And we hardly consider, or very superficially, I'm talking about the people in Geneva, mostly consider animal health and environmental health. Only now we see that thanks to the pandemic treaty negotiation, a kind of a merging of different constituencies, the animal health and the environmental health people are coming on board, which I think is a great news, a great opportunity. So just to reinforce what Jacqueline was saying, less so in the agroecology. So I think it's a route that needs to be still, they are very strong, true, but not necessarily aware of this AMR thing. So there's a lot of work to be done. Tomorrow I will be at the Agroecology Europe conference in Rome, just precisely to bring AMR there. But a lot of work to be done. On the list, I just have an additional special rapporteur. I totally agree with the idea of linking up to the special rapporteurs. I would just add one, which is the special rapporteur on toxics. I think his name is Peter Boyd. He's done fantastic reports and is an absolutely open person to receive and collaborate on these issues together with the others that have been listed in the presentation. And finally, yes, I'm always overwhelmed by Oceana's, titanic efforts of bringing change, real transformation in a very tough Chilean situation where, unfortunately, salmon production is a pillar of the economy. So congratulations on the work that you do. And that's it. That's all I wanted to say, expressing once again gratitude to the three of us. Thank you to the three of us. Yes. Bye-bye.
Thanks a lot, Nicoleta. Would others like to come in? We're getting many comments on the chat. This was really useful and helpful and very inspiring, especially. So we hope that shows that this has been useful in the sense already of creating more inspiration, that sometimes when you have losses in trying to advance some issues, it's great to get a group together again to find that energy to continue on that and that constant work. I'm not seeing any requests for the floor at the moment, so I think we'll be starting to wrap up. I won't try to make any summary of all the discussions that we've had, but I will let you know that we are putting together all the presentations that we've had so far to be able to share those, and that we will be having then also a link to the recording so that everyone may have that available. First of all, again, to thank everyone involved in organizing this. We had some support for UMET, but we had really a big mind support with Anthony So and his team helping this thing through. And of course, setting the first presentation out for the basis of this event. We've had also our colleagues, Vitor and Mirsa from South Center. So thank you to everyone, to the translators also for helping us in this process. And of course, to all the speakers for giving us the time. And with all these time changes, it's always complicated. And then of course, to all the participants as well. So we will also be doing a report, just trying to extract from all the presentations and the comments. And then we will also be making that available, because that's the idea, is that this was just the start of this process that we hope that we'll continue to have. So thank you much to everyone. And I just like to note that we will also be copying the chat, because that was also full of information and sharing of issues there. So that will also be made available. We'll send you a link to the site. It will be on the South Center site. And of course, you also had yesterday and today in the chat a link to resources on antimicrobial resistance and environmental aspects. So we'll be reminding you of that link, and do feel free to share any of your own resources that you think we should continue to add to that to make it as comprehensive and useful as possible. So thank you, everyone. Wishing you a great morning, afternoon, and evening.
Thank you, Viviana. Thank you very much.
Thank you, Viviana. Thank you, everybody.
Thank you very much. Thank you.
Thank you, everyone.
Thank you, everyone.
Thank you to
Stay
everybody.
safe.